So in this video, we're going to be demonstrating an exercise that is an assessment, but also an intervention for you. A lot of times in rehab, we have patients who are keenly aware of imbalances, particularly in their spine and their pelvis, hips, and lower extremities. This is often presented as, Nate, I feel like my left leg is longer than my other. I feel like my pelvis is out of alignment. In many cases, it is true, and there is a alignment flaw or an asymmetry between the sides. And it is most often due to an imbalance between the musculature in the pelvis and the spine. Most of the times, I say most of the times because this is barring no history of traumatic fracture that involved, particularly when they were young, before their growth plates had closed. Sometimes that can be a structural issue, meaning they had a significant tib-fib fracture or a femoral fracture, and they actually have a length issue. This is occurring a little bit less frequently now, specifically with the advent of internal fixation using hardware. So a tibial rod, a femoral rod, or nails. It's less of an issue, but it is still an issue. Less of an issue if the fractures occur as an adult. It is still common if they experienced the fracture when their growth plates were still wide open. So what we're going to do is use an exercise to address this, assess it, but also address it. What you want for a setup is you're going to lie on your back. You're going to use the floor as a sensory map for your back side of your body. So you don't want to do this in a mattress, on a mattress or a really soft surface. You need something like hardwood floor, a firm mat on the floor. Carpet is fine. Concrete, cement, a gym floor, those are all work well. And the more firm, the easier it is to feel those imbalances, okay? So what you're gonna do is you're gonna lie flat on your back first, and then what you're gonna do is just let your knees kind of flare out and then straighten your legs out like so, all right? The next phase is, this is the sensory map. We're gonna use this floor as to map out what our back feels like, okay? So during this phase, you're not gonna try to fix anything. You're gonna keep everything as is. This is just your pre-test. First thing we're gonna do, I like to have you close your eyes. So if at any point during this drill I'm going a little bit too quick, that's fine. Just pause the video and practice what I'm having you try to assess or feel. This exercise is going to take you about 20 minutes from start to finish, okay? So lie flat on your back, arms relaxed at your side, close your eyes. What I want you to feel, we're going to start at the top. We're going to start at your head and feel where your head contacts the floor. Does it feel symmetrical? Does it feel like your head is evenly flush against the floor? Does it feel like one side is more in contact? Does it feel like your head is nodded up like so? Does it feel like your head is in a more neutral or flexed position in your craniovertebral aspect of your spine? Next, you're going whatever contacts next. What contacts next? Is it your shoulder blades on each side, or is it your ribs, or is it your thoracic spine? What does it feel like? If it's your shoulder blades or your ribs, does it feel like one side is more pronounced pressing into the floor than the other? Is one side protruding more than the other? Keep scanning yourselves down. And then what comes next? Is it your lower thoracic and lower ribs? Or is it your lumbar spine? Or is it your pelvis? Pay attention. Does one side feel like it's more protruding into the ground than the other, okay? And again, you're not trying to fix anything at this point. You're just simply taking notes. You're taking inventory, okay? Moving on to the glutes, the hamstrings, and the calves. Do you feel that they are evenly distributed as far as pressing into the ground? Does it feel like one leg is more rotated outward than the other? If you do feel that one leg is more externally rotated, lift your head up and confirm, hey, my left leg felt like it was more rotated out. It was. Sometimes you'll be inaccurate. It'll feel like, hey, it feels like my right leg is more rotated. You lift up, you look, your left side is more rotated, okay? So once you've got that mapped out, one last question I'll ask you as you're lying there, and I ask this to all my patients. If you were laying or lying on a balance beam, would you stay balanced on that balance beam, or would you feel like you'd fall off to one side? That's important. Aside from everything I've had you take inventory on, I think is very important. But a quick and dirty way is, hey, would I fall off to my left, or would I fall off to my right, or am I perfectly balanced? Okay. The ones who feel like they're going to fall off to either the left or the right, or if they felt like they had significant asymmetries as far as pressure, they're going to get a lot out of this exercise. If you feel pretty neutral, you probably won't notice a whole lot. One other thing is pay attention to the span, the distance between where your head first makes contact and whatever makes contact here. Is it your shoulder blades? Is it your upper thoracic and your ribs? Is that span feel high? Is that high and long compared to your lumbar spine? Or does your lumbar spine feel like it's more of a higher gap and longer gap? We see that when somebody has significant anterior tilting of their pelvis and lumbar spine extension. Again, if you feel that, don't try to change anything. Just keep it the same, okay? You're just noting, okay? Next thing you're gonna do, bend your knees up so your feet are standing flat on the floor. From this point on, I want you to keep your thighs perfectly vertical. So I don't want them swaying from side to side. Now, if they go forward or up like so, that's okay, but I don't want them wiggling from side to side. The reason being is this next drill, we're going to try to teach you dissociation, the ability to move your lumbar spine and your pelvis independent of your extremities. Oftentimes with chronic or persistent low back pain, individuals will have guarding, or nervous system will essentially put the parking brake on and prevent you from moving through different ranges of your spine, so largely your spine, even in your extremities as well. But your nervous system, because of the weakness, segment by segment or several segments, will produce strength, pseudo strength, or guarding by, the nervous system just increases muscle tone, okay? When you have that guarding, you have a proprioception problem. You have a very difficult time perceiving segment by segment, or what we would call fractionated movement, the ability to isolate segments in your body, okay? So, as you lie here, imagine there's a clock on the wall. We're gonna take that clock, we're gonna drag it down on the floor, and we're gonna drag it underneath you. We're gonna put it underneath your waist, okay? So at 12 o'clock is at your feet, 6 o'clock is at your head. So that is your bearings, okay? Now we're gonna start moving your pelvis, and we're gonna start moving from 12 o'clock to 6 o'clock, okay? 12 o'clock to 6 o'clock. Think about moving your belt buckle if you had one on, or moving your belly button towards 12 o'clock and towards 6 o'clock, okay? What you should notice when you go between 12 o'clock and 6 is your chin should actually follow. So as I tilt towards 12 and then tilt towards 6, my chin should follow those directions. With these motions, I want you to be lackadaisical with them. Gentle, smooth. Nothing is forced in these, okay? If you feel that there's stiffness, don't try to force the motion. See if there's something somewhere in that chain that you can give up to allow the motion to occur in the direction that you're going without forcing anything. This should not be painful, and it should not be forced. So you're gonna practice about 5 to 10 times of going to 12 o'clock and 6 o'clock. And if you notice that your chin is moving with the direction that you are going, you're doing it correctly. If not, if you notice that it's not moving, it means you're holding tension somewhere, and you need to just learn to relax that, okay? Next thing we're going to do is we're going to tilt our pelvis or our belt buckle or our belly button towards 11 o'clock on the clock, okay? Now notice my legs are moving, but they're moving, my right leg is elongating and my left leg is shortening a little bit. That's okay. As long as they're not moving from side to side, that's okay, okay? So we're gonna go to 11. We're gonna do this about 5 times. If you need to pause the video, go ahead and pause it. Okay, now we're gonna go to, let's do 9 o'clock, which is almost pure rotation. We're gonna do somewhere between 5 and 10 reps. And don't force anything. Now what we're gonna do that we figured these out, we're gonna scour or trace that top left portion of that clock from 12 o'clock down and around to 9. So I'm gonna move my pelvis in that 12 o'clock direction, and I'm gonna trace around to 9 o'clock, and then we're just gonna retrace our steps back, right back to 12. 12 to 9, 9 to 12. Do that about 5 to 10 reps. If after 5 reps you still feel like your technique is cleaning up and the motion and the movement's getting better, keep going until 10 reps, okay? Okay, we've explored that area of the clock. Come back to the middle. We're just gonna do a few reps of 12 o'clock to 6 o'clock. And now we're gonna do the same thing going to the top right-hand portion of the clock. We're gonna aim our belt buckle or belly button towards 1 o'clock, okay? Pay attention to any differences. Sometimes they're subtle, sometimes they are not so subtle. You'll notice a big difference between your left and your right side. If you notice a big difference, you wanna take some time and practice the ability to isolate and fractionate these motions. Okay, we're gonna do 3 o'clock. Almost pure rotation or torsion. Rotating my pelvis towards 3 o'clock. Again, you want to think about doing 3 to 5 reps, or excuse me, 5 to 10 reps. Now that we've figured out how to trace that portion, those individual times, we're going to go up to 12. We're going to trace down and around from 1 o'clock to 3, 3 o'clock to 12. 1 o'clock, 2, 3, and then back to 12. Again, 5 to 10 reps. Pay attention to any asymmetries. If one side feels worse than the other, you want to spend a little bit more time on this and make sure they feel the same. The arc should be the same on each side. Don't force it to be the same size. If you can't go and make it the same, don't worry about it. It'll come with time and practice. Okay, now we're gonna go from the bottom portion of the clock. We're gonna do 6 o'clock. We're gonna go to 7, okay? So now we're doing something a little bit different with our pelvis. It's behaving a little bit different. We're now going into more of a posterior tilt, a posterior bias, okay? On one side. The other side's still gonna go into more of an anterior tilt. But as I go to 7, this left side rotates posteriorly, the right side rotates a little bit more anteriorly, relatively speaking. Now we're gonna go to same, we've already done 9, but we'll do 9 o'clock again, okay? And if you wanna break up these movements, and we did 7 o'clock, if you wanna try to more of an 8 o'clock, that's okay too. Practice going to 8 o'clock. We figured out how to do 6 to 9. Now we're gonna trace. We're gonna go to 6 o'clock. We're gonna round around to 9, and then we're gonna right back to 6. We do that about 5 times, okay? And just make sure, open your eye, make sure your thighs are staying vertical through these motions. If one is elongating and one is shortening, that's okay, that needs to happen. I just don't want your thighs going back and forth. We're gonna finish on the bottom right side of the clock. So we're gonna go to 5 o'clock and then back to 5 o'clock and then back to neutral. 5 o'clock, back to neutral. We're doing 5 to 10 reps. If you're stuck here, if it feels real foreign on any part of this clock, hit pause and practice, okay? Practice, practice. Okay, now we did 5, let's do 4 o'clock, okay? So not quite all the way out to 3, not pure rotation or not pure torsion, and then back. We'll do 5 to 10 reps at 4 o'clock. Again, if it feels foreign, hit pause, spend some time here. The more you do this, the shorter this exercise will become. Okay, now that we've done the entire clock, we still got a scour. We're gonna go from 6 down and around to 3, then back down and around to 6. You can reset after each one or just stay held at 6 and then scour around, trace around, and retrace your steps back. I'm just gonna do 5 reps. 4, 5. Okay, next part is we're gonna do circles all the way around the clock. We're gonna do clockwise. We're gonna do 5. Your motion, again, remember your thighs stay vertical. You want a circle. If you feel like it's more of an ellipse, make your circle smaller. If you have pain with this, make your circle smaller. Go small, okay? You're still getting the benefit. This exercise is mostly motor learning, just rediscovering how to move your pelvis and your spine independent of your extremities. You get 5, we're gonna go 5 the other direction. We're gonna go counterclockwise. Again, just make sure that your thighs are staying vertical during this, okay? When you get 4, 5. Now we're gonna go quick. 5 clockwise, 5 counterclockwise, okay? So you're gonna do them a little bit faster. But make sure, you can go as fast as you want. Just make sure that it's a circle and less of an ellipse. If your circle feels like an ellipse, you gotta go slower, okay? So we're gonna do 5 in this direction. Okay, now that we're done, we're gonna take our knees apart on the outsides of our feet, and we're gonna just straighten our legs out, okay? Now what I want you to do is take inventory, that same mapping, that same inventory that we took in the beginning. You're gonna do the same thing. How do you feel? Most of the time when patients have significant asymmetries between side to sides, they are already feeling significantly more symmetrical. Hey, if you're laying on that balance beam, would you fall off to the side still? No, Nate, I feel like I'd stay right here. Okay, so you just reset some of that tone that your nervous system was holding because of a lack of familiarity, a lack of practice, a lack of using that motion. When our nervous system doesn't practice motions often, we lose it. So what happens is, for sake of protective purposes, your nervous system will prevent you from going through those areas that are vulnerable because your brain doesn't have good command over those motions. So what does that look like? It feels like persistent tightness. This is why people who stretch their lower backs persistently, they always have to stretch it. They're taking away that safety mechanism that your nervous system is implementing. So sometimes we don't get through tightness or stiffness in extremities or in the back by stretching. We need motor control. We need the command. We have the hardware. We got to update the software here. That's it. Okay. So what I would have you do next is pick a side after you take inventory, head to toe. Check your legs. My left leg was significantly more rotated out than the right. Now I look down, left is still more, but my right has improved. There's a better balance. Pick a side, you're gonna roll onto your side, come on up, and then you're gonna stand with your eyes closed safely, and then just take inventory in standing. You may notice that one leg now feels longer, or it may feel larger. The larger is a common phenomenon. Hey, Nate, it feels like my right leg is bigger. That's normal, and it's usually fleeting within a few minutes, okay? Walk around, take a few steps. Your gait may feel different. Remember, if you are walking around, your nervous system, your operating system was operating under certain circumstances and conditions. One leg was functionally lengthened or longer than the other. Well, now that you just did this quick little reset, your gait may feel a little different because now you're walking with a stable base, a neutralized or normalized base. It may feel like one leg is longer. It's not that that leg is longer, it's just the leg that was longer is now shorter, and the other leg that was relatively shorter feels longer. And again, that will fix, it'll self-correct in a few moments. You'll get used to it. But when you get a hang of this, you can do this before any exercise. You can do it after you get out of bed. You can do it in bed. You just can't feel the sensory map portion of it, right? So you can do that. You can make this your warm-up before you do any sort of upper body, lower body, functional training. You can do it before anything. And it doesn't have to take you 20 minutes because once you understand how to do this, how to assess and intervene, it'll take you 2 to 3 minutes, just as a quick tune-up before you exercise and move. So try these things out. If you have any questions, don't hesitate to reach out. Thanks for watching.